Hi guys, how's it going? So my name is Dr. Andy Wu and I'm a psychiatrist in the Boston area. I started this podcast, Good Psychiatry, because I noticed that when a lot of people end up reaching out for help, they're not really sure what sort of help that they need. And I think the reason for this is because the mental health field is really full of a lot of jargon and a lot of confusing concepts. So what I actually end up doing with a lot of my patients who start out working with me is to really try to teach them and simplify some of this complicated jargon and psychiatric concepts to them, just so that we can even just start trying to figure out what sort of help that they need, or in some other cases, trying to find out if there's somebody else or some sort of other treatment that I can't offer that they could benefit from. So for this episode, I'm going to explain 3 common therapy frameworks that contemporary therapists use to treat anxiety in individuals. The first of this being the cognitive behavioral therapy framework, or the CBT framework. The second being the dialectical behavioral therapy framework, or DBT. And the third, which I think is the most misunderstood, is the psychodynamic or psychoanalytic framework. Oh, so before I get into these different schools of therapy, I'll also just say that in general, if somebody comes into my office with a main complaint of anxiety, the first thing I usually tell them is that it is totally a normal and natural response for the human brain to experience anxiety. This is something that is inherently baked within all of us humans and animals in terms of being able to survive, being able to respond to threats, and being able to plan ahead. Now, don't get me wrong, I think by the time somebody shows up to my office with a complaint of anxiety, very likely they're experiencing levels of anxiety that are more intense, more frequent. Maybe they're experiencing panic attacks, they're having trouble sleeping, or they're having chronic issues of stress and trauma responses where the brain's ability to respond to normal situations and their threat detection is sort of on overdrive all the time. But it is helpful to be able to set the stage to say that anxiety is a normal and natural response that you can't ever truly take away or just ignore. Now, as a psychiatrist, I have to acknowledge that medications definitely are talked about and discussed with trying to treat anxiety symptoms. However, just from a general standpoint, not everybody who experiences high levels of anxiety needs to be started on any medication, and a lot of them, with their first steps, by seeing a therapist, are able to actually get quite a lot of benefit from seeing a therapist and addressing their anxiety that way. So probably the most common therapy, if someone were to look up a therapist near them that could see them, that they practice, is called CBT, or cognitive behavioral therapy. And I'm going to put a diagram of the CBT triangle up here. Sorry, my camera is slipped, so I got to make sure that I'm pointing in the right direction. So here is the CBT triangle, and the 3 legs of the triangle are your cognition, which is your thoughts. It has your behavior, which is how you act, and then it also has your feelings, which is what you're feeling. And in the case of anxiety, that's kind of where they would conceptualize and put that feeling over there in terms of this triangle. And this triangle is really helpful in terms of visualizing the fact that all 3 of these legs, they all sort of feed off of each other, and they're all interrelated. And you may have a thought which may lead to a certain behavior, which may lead to a certain feeling, and it all just sort of ends up like combining in with each other, and it gets very overwhelming and really gets very messy. So in my experience, why people tend to get a good response from a CBT-based therapy is the fact that by actually meeting with the therapist and by actually trying to put down their specific thoughts, their behaviors, and their feelings, they're able to conceptualize the actual experience of anxiety for them in a very organized and not overwhelming fashion. And that sort of contrasts with their actual experience of the anxiety. So just by putting it down and organizing like this can make a lot of patients just feel less overwhelmed when they're dealing with anxiety in the future. The other thing I like to also emphasize with patients who are interested in a CBT approach is to acknowledge that in terms of that CBT triangle, your thoughts, your feelings, you actually don't really have that much control over those two legs of the triangle. The one thing that you have control over in terms of this triangle is the behaviors portion. So really focusing on what you can control, really focusing on incorporating behaviors that lessen your anxiety, decreasing behaviors that increase your anxiety. This can also be very helpful for people when they're using a CBT approach. So obviously not everybody universally benefits from one school of therapy. So in my experience, I think the people who really seem to get a lot out of CBT are the people who really appreciate the coaching aspect of the therapist. So what I mean by that is they're able to feel like the therapist is someone who is partnering up with them in tackling anxiety as a problem, and they really appreciate the added accountability, and they appreciate the fact that the therapist is able to really organize and try to conceptualize their anxiety into something that is overall less overwhelming for them. So the next school of therapy I'll give a brief overview of is Dialectical Behavioral Therapy, or DBT. So the best way I'd like to try to explain this to my patients is that it's sort of an offshoot of CBT with an incorporation of Buddhist or Eastern principles related to meditation and mindfulness. Kind of interesting how it got started, to be honest, but I won't get into that today. A lot of DBT is related to trying to build skills to try to reduce anxiety levels. So some people in their research may come across the fact that DBT is only used to treat borderline personality disorder. I'm going to push back on that slightly and say that DBT actually can be helpful for a wide range of conditions. Today, I'm focusing on anxiety. So a lot of the skills that you would learn in a DBT-centric therapy can be very neatly applied to reduce anxiety. So as an example, there's a DBT distress tolerance skill called TIP skills. So that stands for temperature, intense exercise, paced breathing, impaired muscle relaxation. And by going through a DBT framed therapy, you would be able to learn these skills and potentially decrease your anxiety. And the second thing that I touched on earlier related to the Buddhist principles is that DBT does a lot of skill work with mindfulness and acceptance. So in terms of mindfulness, being more aware of your current emotional experience, your current thoughts, and by bringing more awareness to the present moment, a lot of people are able to experience decreases in their anxiety levels. The second thing that I just mentioned with acceptance has to do with understanding and acknowledging the limitations of what you can and cannot control in a certain situation. Now, don't get me wrong, I think that not everyone could benefit from viewing their anxiety in this framework, but just in my experience, some of my patients really do get quite a bit out of the acceptance portion of dialectical behavior therapy. So the last therapy I'm going to give a brief overview of is psychodynamic, otherwise known as psychoanalytic therapy. And I think this is the one that most people have the most common misconceptions about. I think part of that is on psychodynamic therapy in terms of how it's taught and how it's practiced. There's a lot of jargon and there's a lot of things that don't entirely make sense if you just try learning or researching it from a superficial standpoint. But I'll try to explain some of the basics. By no means am I an expert in psychodynamic therapy, but I'll do my best in trying to explain it. So at the core of understanding anxiety from a psychodynamic lens, you have to focus on what the therapists describe as intrapsychic conflict. And really, this is just a fancy way of saying that there's one part of your brain that wants to do or feel a certain way, and then there's another part of your brain that wants to do or feel a different way. And because you see the pros and cons of each situation, you're not entirely sure which direction to go in, and because you don't really know what direction to go in, you feel anxious. So that's the sort of core theory in some parts of psychodynamic theory, which is that anxiety comes from intrapsychic conflict. And so what gets even more confusing with this concept of intrapsychic conflict is that not everybody is fully aware of what the different parts of their mind are telling them. And so part of the work with the psychodynamic therapist is really taking that time to really explore what the hidden and unconscious parts of your mind are telling you, and really trying to see if you can get a better understanding of this, and in doing so, try to get more of an agreement among the different parts of your mind so that you get less anxiety. Another component of the psychodynamic work has to do with recognizing certain patterns of behavior, certain patterns of the ways in which clients live their lives that they're also not necessarily fully aware of, and trying to see whether or not these patterns that are discovered during the therapy are leading to certain feelings or anxiety. So trying to identify these patterns, trying to figure out if the client wants to change these patterns, if they feel like they can change these patterns. This is also a big component in terms of trying to have clients feel better with the psychotherapeutic work. So if you've reached the end of this video, thank you very much for watching all the way to the end. As I said before, I'm a practicing psychiatrist, so making videos like this is by no means my actual day job. I'm hopeful that this video was helpful if you came across it. I think there's a lot of information out there right now in social media that's a little bit out there in terms of mental health advice and treatment tips. So at the very least, I thought I could be able to share what a actual practicing psychiatrist thinks about certain treatments. So I'll try to come up with a few more videos in the future, again, depending on how busy I am in my practice, but hopefully this one was helpful to you.